Hi everybody, it's Martha Kennedy. I want to talk to you about dialysis communication forms. It is Nexion's process that every resident that goes to dialysis takes what's called a dialysis communication form with them each time they go. Now this form should be available to you, and if not, you can find it on the hub under clinical, under policies, and then clinical essentials, and dialysis, and it says it right there. It says dialysis communication form, and you can print those out if you need to, or if you need a clean copy. So let's talk about what's on the dialysis communication form and what our responsibility is and what we ask dialysis to do. Now, this is not anything new to the dialysis clinics. They fill them out for all their long-term care residents. And I'm going to turn this around and show you the actual form. Okay, so at the top you're going to see it's labeled dialysis communication form, and you see in the right-hand corner it has the Nexion symbol. If it does not have the Nexion symbol, then it's not our form, and we don't use that one. We use this one. So at the top you'll see that you put the date and the general information. It gives you instructions to be completed by the facility. The first thing is the resident's name, the dialysis frequency, the time, the dialysis center. You want to put their attending physician's name on there, and then you want to give them a nurse contact or a contact person where they can call, should they need something or have questions. The unit number, hallway, same thing. Any care plan meeting or any updates, you wanted to go there. Now, the resident-specific pre-dialysis information is next, and if you notice right underneath it, it says to be completed by facility, okay? So that's what we do. So we're going to put any medications administered before, they went, any meal provisions, meaning, do they have thickened liquids, that type of thing, any condition alerts. Okay, so the resident has a new skin tear, the resident is feeling, short of breath, they're on oxygen, anything like that is going to be put under condition alerts, and any care plan updates, maybe any new interventions we're doing that we want them to know about. Then you as the nurse will sign and date. This record or this sheet will go with them to dialysis. If they're going by stretcher, then you would send it with the EMTs. If they're going any other way, you want to make sure that it does go with them to dialysis, and that it also returns. So let's look at the next area. Let me see if I can get that to come down. Okay, so the next area says, and if you'll note, it says information to be completed by the dialysis center. So this is what dialysis is going to fill out and send back to us. You want the pre-wait, the post-wait, which they do at all dialysis centers. You want the dialysis was completed without incident, yes or no, and if it wasn't, then we want to know why. Any problems with the access, graft, or the catheter, we need to know that so we can continue to give them the care on it. Any lab work that was completed, and if there was lab work, we ask that they send it to the facility. Any medication they gave at dialysis, sometimes they'll give IV medication, so forth, we want to know about that. And any new recommendations they may have from dialysis. Sometimes you may have a recommendation from the dietitian or from the doctor. And then you want the dialysis nurse signature, the date, and then the phone number or fax number. This is in case you have any questions. Now remember, when somebody comes back for dialysis, you want to know that you have this form back with them. Now, if you do not get this form back, I want you to call dialysis and ask them to fax it to you, or we can go and get it, but it's really important that we get these forms back every time they go to dialysis. Now, what do you do with the form when it comes back? Of course, you're going to read it. You're going to see if there's any new lab work that you need to tell the doctor about, any new recommendations, and make sure those are followed up. Once that is done, you want to have this scanned into the patient's medical record. It will go under the tab that says document manager or miscellaneous, and you want to make sure that that's put in there so that we have one for each time the resident goes to dialysis. So it's really, really important that we get those. Thank you guys. Have a good evening.